Okay, good afternoon, everyone. Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de la COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Before we begin, a reminder to place your microphone on mute until I invite you to ask your question. Avant de commencer, j'aimerais vous rappeler de désactiver votre microphone jusqu'à ce que je vous invite à poser votre question. Today, we will be hearing remarks from Mayor le Maire Jim Watson, followed by Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique. Available for questions from the media following the statements, we also have, disponible pour répondre aux questions des médias, nous accueillons aussi Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, Anthony DiMonte, General Manager of Emergency and Protective Services, directeur général des services de protection et d'urgence, and Dan Cheney, General Manager, Cultural and Facility Services, directeur général, service des loisirs, de la culture et des installations. After we hear from the panelists, we will take questions from the media. We will now begin with remarks by Mayor Jim Watson.
Well, thank you very much. Merci beaucoup. Good afternoon, everyone. Bon après-midi, tout le monde. And Happy New Year, bonne année. My thanks to all of you for joining us today. Earlier this afternoon, we heard from the Premier that the province will enforce stricter shutdown measures starting Thursday at 12:01 a.m. These restrictions are focused on tackling public and private gatherings, one of the primary drivers of the spread of COVID-19. The stay-at-home order reiterates the need for all of us to stay home as much as possible and to limit our interactions with those outside of our households. The modeling that we saw earlier today should be alarming news for everyone in our province and here at the City of Ottawa. Les modèles que nous avons vus plus tôt aujourd'hui devraient être une nouvelle choquante pour tout le monde dans notre province et dans notre ville. The evidence that is before us shows us we must do more to stop the spread of COVID-19, and that is why I support the decision to implement these further restrictions. The city will soon announce how its services will be adjusted in light of these new restrictions. This is a critical time in Ottawa for our COVID response. As many of you heard from Dr. Etches over the weekend, the numbers in our city are increasing at an alarming rate. We are in the red zone and we're approaching gray territory, and we have higher percentage of positive tests coming back and an increase in hospitalizations. If we can't get these numbers under control, our hospitals will not be able to maintain services, and tragically, the number of deaths will increase. Et tragiquement, le nombre de décès augmentera. I want to reiterate this messaging today because we need to continue to follow the provincial guidelines and the advice of Dr. Etches and Ottawa public health officials. This, of course, is critical. This means limiting trips outside your home for only essentials like getting groceries, picking up prescriptions, and attending medical appointments. It also means maintaining your physical distance from people outside of your household, wearing a mask when in gathering, when interacting with those outside of your household, even when you're outside. Unquestionably, these restrictions are difficult for everyone, residents and businesses alike. Sans doute, ces restrictions sont difficiles pour tout le monde, résidents et entreprises. In many ways, today's news feels like we're back in the early days of fighting the virus. Today, however, we do have one advantage that we did not have before, and that, of course, is the vaccine. OPH, the City of Ottawa, and the Ottawa hospital staff are working diligently to ensure this vaccine gets out as quickly as possible, and we are making good progress here in Ottawa. As soon as we received word that the Pfizer vaccine could be transported, we immediately mobilized our mobile vaccination units to reach our most vulnerable in long-term care homes. This was the first time that we transported the vaccine, so it was an all hands on deck to make sure that we did it safely and successfully. And Ottawa, I'm proud to say, was the first in the province to move the Pfizer vaccine, and I'm proud of our local leadership here. I'm pleased to say that our vaccination teams have been to 12 out of our 28 long-term care homes over the past week alone. We started vaccinating residents only, but we have been able to move on to include caregivers as well as staff. Both paramedics and long-term care medical staff have been administering the doses, with OPH nurses responsible for the communication and the coordination of the facilities, as well as overseeing and coordinating the clinics along with paramedics. I want to thank all of them, especially our paramedics who are going into these long-term care homes, for their outstanding work. Je tiens à les remercier tous pour leur travail remarquable. Today, I'm pleased to announce that earlier this afternoon, we received a new shipment of vaccines, and we will be deploying first thing tomorrow morning. Je suis fier que nous venons de recevoir une nouvelle charge de vaccins et il sautera dès demain matin. This is, of course, still early days of vaccine distribution, and we have a long way to go until it will be widely available to the general public. Until such time, I want to reiterate the need for all of us to follow public health guidelines. And I know I sound like a broken record. Many of us do that have been communicating with you. We're sick and tired of the COVID-19 crisis that we have before us, but we have to repeat these messages because clearly a portion of our population are not following the rules, are being irresponsible, and at the end of the day, putting all of us at risk. We came from a very positive position in December, where we're one of the best cities in the country. And now, unfortunately, we're not doing well at all because just too many people have not been following the rules and the regulations. So please wear a mask when outside of your home. Practice physical distancing. Wash your hands with warm water regularly. Only leaving your house for essential reasons like to pick up groceries, medication, or to get exercise. Limit your close contacts to only those in your household. And if you haven't yet, please download the COVID Alert app. Again, I want to send the message that we need to work together in order to bring our COVID numbers back under control in Ottawa. Before I hand it over to Dr. Etches, who continues to do a remarkable job, I wanted to take a moment to acknowledge the hard work that the vast majority of our residents and businesses have done to limit the spread of COVID-19. And I say that with all sincerity. The vast, large majority of our residents are following the rules. It's that small minority that's hurting everyone else. I know these last months have been difficult for everyone. You're all tired, you miss socializing and seeing family and friends. Some of you have missed weddings and funerals, and it's heartbreaking. You miss doing some of the activities you enjoyed doing before the onset of the pandemic, like enjoying a fantastic meal at one of our great local restaurants or getting a good workout at our gyms. And our younger residents are missing the interaction with their friends and teachers at school. However, your collective efforts in following public health protocols have meant we still have a shot of slowing the spread of this virus and reversing our course. I'm asking you to keep these efforts up. Je vous demande de continuer ces efforts. We've got a difficult number of weeks ahead of us, but I know we have what it takes. We've done it before, as I mentioned, and we can do it again. Let's continue to work together to protect everyone's health and safety. Thank you very much. Merci beaucoup.
Merci, Mayor, and hello, everyone. Quay, bonjour. The current trends indicate that the levels of COVID-19 in our community are among the highest yet since the beginning of the pandemic. More people are testing positive, the positivity rate and hospitalizations are increasing at a rapid pace, and we're seeing more outbreaks. There are more close contacts per individual testing positive. The COVID-19 wastewater viral signal also continues to trend upwards over the past few weeks. So all of our monitoring indicators for COVID-19 mean that Ottawa is once again in crisis territory. Selon nos indicateurs de la COVID-19, Ottawa est de nouveau en situation critique. So people of Ottawa, I need you to commit to what you are going to do next to improve this situation. Some may have gathered with a few family members over the holidays. Some might have been in crowded stores or on crowded rinks. Children may still be playing with their best friends to blow off steam after online school classes. Others might be meeting with friends or extended family without distance. It's too late to change today's numbers. It's not about what we did last week or yesterday. It's what we do next that will make a difference. Il est trop tard pour changer les chiffres d'aujourd'hui. Il ne s'agit pas de ce que nous avons fait la semaine dernière ou hier. C'est ce que nous ferons dès maintenant qui fera la différence. The provincial measures announced today will support us to slow the spread of COVID-19 in the community by limiting the number of opportunities for COVID-19 transmission. And while these measures make rules for public places and spaces, it's what we do next, our everyday individual decisions that will lead us out of this difficult place. It's not what any of us wanted, but it's what we need to bring levels of COVID-19 down, to stop outbreaks, to protect hospital capacity, to save lives. We've seen how quickly things can change, even in the last few weeks. For example, on December 11th, the 7-day average of people testing positive was 43 per 100,000. And on January 11th, yesterday, it was 137. Another staggering figure is the number of people testing positive by week. So for the week of January 3rd, 1,008 people tested positive for COVID-19, by far the highest number we've seen in 1 week since the beginning of the pandemic. And what these numbers tell me is that more people are coming into close contact with people from outside their households, and COVID can be transmitted in those situations. Over the last 11 months of the pandemic in Ottawa, I've seen people in Ottawa adapt to new ways of doing work and business and keeping our distance from others, from doing the mask wearing, limiting contacts, and I'm very proud of the community. Au cours de ces 11 derniers mois de pandémie à Ottawa, je vous ai vu vous adapter à de nouvelles façons de travailler en gardant votre distance de l'un l'autre, en portant des masques, en limitant vos contacts, et je suis tellement fière de cette communauté. And Ottawa, I know you're exhausted. I know parents are trying to balance work, life, helping their children with virtual learning, and your own personal lives. We have data that the stress caused by this situation is significant, and we need to be compassionate and realistic about what we can achieve at this time. We're asking employers to once again be understanding and accommodating if their staff require more flexibility in their work schedules. I know businesses are suffering, and people living with mental health issues are struggling. Our isolated older adults, racialized populations, caregivers, those who are more severely impacted by COVID-19, teachers, healthcare workers, people with a loved one in long-term care, people who have recovered from COVID, the people who have lost loved ones to COVID. So many, and we all are hurting right now, and it's why we need to band together. Ottawa, nous souffrons tous en ce moment. Nous devons nous unir. Je sais que vous êtes épuisés. Nous avons les données confirmant que le stress causé par cette situation est important. Nous devons faire preuve de compassion et de réalisme quant à ce que nous pouvons accomplir en ce moment. Et il y a de l'aide disponible si vous êtes en difficulté. Je vous encourage fortement de consulter les nombreuses ressources gratuites en santé mentale sur notre site web. Crisis is a powerful teacher, and we've learned a great deal about our strengths as well as our limits. And if there's one thing that stands out to me, it's that we are strong and we are resilient. We will make it through this pandemic, but only when we come together as a community to support one another. We can't do this alone, and there is help available if you are struggling. Many free mental health resources can be found on our website. This is a collective task, one where we need to support and not blame each other through this dark time. We have the power to reduce transmission of COVID-19 in the community, limit close contacts to those you live with, plus essential supports such as childcare, practice physical distancing, wear a mask as much as possible, wash your hands frequently, and stay home except for essential reasons. These same tools and strategies will continue to bring down COVID rates in the weeks and months ahead. Nous devons faire de ces comportements notre routine pour les mois à venir, jusqu'à ce que nous ayons une protection claire avec les vaccins contre le COVID-19. So for now, Ottawa, we have a lot of work to do. We have the tools that work. The goal is to get back to a place of balance, like in November and early December, when we were using our tools to live with COVID, with declining or stable levels that allowed schools to open and be managing the situation, more businesses to stay open. We need to maintain these behaviors as our routine for the coming months until we have clear protection with COVID-19 vaccines. I know we can do it, and we'll continue to be with you every step of the way. Miigwech, merci, thank you.
Thank you very much, Dr. Etches and Mayor Watson. I will now invite questions from each agency alphabetically. You may ask one question with one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now start with Kate Porter at CBC Ottawa.
Hi, everybody. Could you please explain how this will change enforcement, this stay-at-home order? We had these limits on sledding hills, rinks before. Now there's a stay-at-home order. How will that be enforced and by whom?
Tony?
Thank you, Mayor. Hello, Kate. Throughout this pandemic, when new orders came out, it takes a couple of days to see the details of the regulation. So I don't want to get into too much detail, but in essence, the province has already indicated that we will have those regulations likely by tomorrow afternoon. So we'll be looking at them. But this does move us back, as Dr. Etch has said, and the Mayor has mentioned. It reminds me very much of what we did at the beginning of this pandemic. We were at the beginning of the crisis. It is quite possible, and that's what we're going to be reviewing this afternoon. The city manager's called a meeting with all the senior leadership team to start looking at that. It may mean that we will be shutting down some of the city operations, including rinks, etc. But again, the details will be part of the review. Directly to your question with regards to enforcement, the enforcement of that will be done by bylaw officers, or police officers have the authority as well too. So we're looking at something I think would remind people very similar to what we had last spring.
I understand that not all the details are there yet, but I'm also just trying to figure out how to explain to people what they can or cannot do. So if there are outdoor limits to gatherings, like should they or can they be out in the park around a rink? Can they go to Canadian Tire to pick up something that's not groceries? You see what I mean? Like, what advice should we give people about what constitutes something essential that you should or shouldn't be doing right now?
Well, Kate, again, I'd like to be able to give you a definitive answer, and I think it's important that we do that as soon as possible. But again, I want to see the regulations. But it seems quite clear to me that the objective here is to stay at home as much as you can and only travel outside of your household for essential things such as groceries, medical appointments, and perhaps walk around the block to get some exercise. But the tone of what I heard this afternoon from the Premier and the decision the Cabinet made was one that reminded me very much of what we did last spring. So as soon as we have those details, we'll certainly be getting back to you, and our team will be communicating that clearly, because I think that is important information.
Okay, super. Thank you all.
Thank you very much. Moving on, we will be going to Eric O'Brien at City News.
All right, thank you. My question was kind of that, but instead I'll ask Dr. Etches this. How do you think we're already seeing impacts on mental health during confinements? How do you think these extended measures will impact people in Ottawa?
I think that these days and weeks ahead of us now, with schools closed, with more emphasis on staying at home, will draw on our resiliency. We'll really need to be supporting each other, checking in with each other. It can be hard when people are stressed and tired, and I think that we need to focus on how we can encourage each other with little messages, with reaching out, getting a little bit of physical activity in each day outdoors. We do know this is a challenging time, and we know that people can be tipped to that point of crisis, and we have a distress center line that can connect people to supports that are available right away. We know for women who may be experiencing violence in the home that there is a chat service available that we do encourage people to make sure that they're reaching out to help others. There's no question, this is some of the most difficult days. And so I think we want to find what keeps us going. Be realistic. We can't accomplish everything all at once. Teaching and parenting and working. So finding what works for your family, I think is important. Where people are individuals, isolated, there is still room to connect with one other household exclusively. We don't want people to be on their own without any support at all. And we know some people will still need to access essential childcare. So these are important, what we would call essential supports.
Now, in your professional opinion, doctor, do you think these new measures put in place are enough to bring us back to and the time frame that was given are enough to bring us back to where we were, like you were saying before, in November?
Yes, I'm only going to speak about Ottawa. I can't speak for the whole population across Ontario, but I do believe what will make a difference in Ottawa is individuals taking this signal from the province that, yes, we are in crisis again. I'm saying the same thing about our numbers here in Ottawa. The mayor is saying the same thing. We know that people will pick up on that signal that it's time to take a look, check your blind spots, and reduce those contacts that you have with others. That will work. Absolutely. I think that we've seen it before when people limit their contact with others, wear their masks. We have turned the curve. I do believe it can be done again.
Thank you, doctor.
Thank you, Eric. We will now be going to Ted Raymond at CTV Ottawa.
Hello, thank you for taking my questions. So I guess my question now is for Dr. Etches, just based on some of the comments. I know that Mr. DeMonte says they're still working on figuring out these regulations, but in the context of exercise and getting outside, this is, as you say, an essential thing and something that people should be doing. But with this new stay-at-home order, people are at risk of being fined, possibly if there's too many people around. We've got a gathering limit of 5. What would you say to people who still want to go outside for exercise despite this, but with this order in place? Like, what are we going to do about this? How are we going to reconcile these two things?
We do need more information from the province about exactly what they're envisioning restricting, but I do read in the acknowledgement that exercise is essential, that there will be some ability for people to get outside every day, and I strongly recommend that. I have all along. I think where we maybe need to adapt is that we need to make that exercise closer to home, and we need to avoid, well, actually that's my advice anyway, is avoid places that are crowded. I mean, choose to walk in areas, go to open spaces in areas that are not crowded, and in smaller numbers. I think we do see this is clearer today. The gathering, like, they're talking about if you're going to go out with your household, like, make sure that's just your household, that you're not gathering multiple households together when you're going out for exercise.
Okay, thank you. And I do want to just touch on maybe a little bit more on enforcement, Mr. DeMonte. Now, I know that obviously you're still waiting for more details and you're going to be planning this out, but what can we say in terms of what kind of interactions people might expect with bylaw officers or police? Are police going to be stopping people when they're outside and questioning them? Is that part of the plan, or is part of something that you envision?
Yeah, since the beginning of this, and I've said it and repeated it several times, our objective in enforcement is a tool to achieve our public health goals as a community, to keep down COVID till we're all vaccinated and return back to normal. So it's just a supplementary tool. Our bylaw officers and the officers of Ottawa Police Service as well, our interactions are always towards that objective. That said, it's clear that over the last weekend, we saw behaviors that aren't compatible with that. And certainly we will, I guess the right term is ramp up our enforcement to ensure that people respect the rules that are put in place so our community can get back to a healthy state. Again, I'm being very careful, Ted, because I think, facts and data are important. And so we want to see the facts, we want to read the regulations, see exactly what the provincial government wants to achieve here. And then we'll be using the regulatory tools and doing enforcement to achieve that. So I guess the message is quite clear. Our expectation is people will be respecting those rules. And as Kate asked earlier, once the clarity is there and we understand it, we'll make sure that everybody knows what they are, but we will be enforcing those rules as well.
Thank you very much.
Thank you, Ted. We will now go to Craig Lord at Global News.
Hi there. I think this would be a question for Dr. Etches. For a long time in the pandemic, we've had this idea of essential supports for people who are maybe a single parent or someone who's living alone. Do you expect that there might be exemptions to continue to allow essential supports to visit people that they need to, even under this new lockdown?
Yes, I do think that is important. People will understand what's essential for them in that category. I mean, the big picture is that we want to limit the number of contacts we have. And, we were able to keep COVID levels declining or stable with, this approach of having essential supports where needed. We need to really focus on that being consistent. So if you need another person to help you, that's always that other same person, if as much as possible. Just everything we can each do to limit the opportunity for COVID to pass between people where there's close contact without masks. It adds up. We can see that it's so powerful. Our individual actions that add up collectively to protecting the community. That's what we're aiming for again.
Thanks very much. And I have a question for Mayor Watson.
Le modèle que nous avons vu plus tôt aujourd'hui devrait être une nouvelle choquante pour tout le monde dans notre. Today, a critical time in gathering when interacting with those outside of your household, even when you're outside.
I think there's some echo from Eric. Sorry.
Okay. Sorry, go ahead.
Are we good? Oh, yeah, sorry. So Mayor Watson, you said that you're feeling like a broken record because there's this portion of the population that doesn't seem to be listening, not seeming to follow the rules. But Premier Ford said earlier today that, the responsibility for this lies on him. I'm curious, how much of the responsibility for the current crisis do you think falls on the city, whether it's a failure of communication or regulations? Do you believe that any of that responsibility on the current situation is on our local institutions here?
Well, I think anyone in a leadership role, whether it's at the municipal, federal, or provincial level, or in healthcare, shoulders both responsibility, and the head of the city council, then I take that responsibility. I think what we're trying to do is to get to those small portion of people that are ruining it for everyone else. For instance, I would like to see the province clamp down on big box stores that are using the guise of selling food to sell golf clubs and furniture and patios and so on. It just is not the time to be going and doing that kind of a shopping, crowding a store with hundreds, if not thousands of people. So I appreciate the fact that the province is going to clamp down on the crowd sizes at these big box stores, because I think we've all seen the pictures on social media, and we've all seen it in person. If you've gone to a Costco or a Walmart, hundreds of people lined up at the cash registers buying things above and beyond food products. And while we appreciate the crackdown on lineups and overcapacity, I think we also have to rope off those sections of the stores that are selling non-essential products for two reasons. First of all, there's no need to endanger people with larger crowds buying these products. Like I said, sound systems and stereos and everything else. And at the same time, it's fundamentally unfair to our small businesses who don't have that advantage, that they can allow people to come in and buy products at their small shops, but Walmarts and Costco's and other big box stores are allowed to do so. Thank you.
Thank you very much.
Thank you very much, Craig. Moving on, we will go to Elizabeth Payne at the Ottawa Citizen.
Thank you. This is a question for Dr. Ed. Today in the technical briefing, two Ottawa hospitals, the Civic Campus and QCH, were among hospitals in the province with just 2 intensive care beds left. Given what you've told us about our numbers rising, what does Ottawa look like compared to the rest of the province when it comes to the seriousness of the case increase right now and our health system's ability to cope with that?
So Ottawa is among the health units that have had a steeper change from before the holidays until this point. So the rapid rise in cases is significant, and then the hospitalizations follow. So we are now starting to see those hospitalizations increase, and our hospitals are managing right now, but it's not something where they can continue with this rate of increase and be able to avoid canceling procedures that others need, non-COVID types of interventions related to, say, cancer or heart disease. So this is something that the hospitals are very closely preparing for and ready to manage if the numbers keep going up. I think that I talk about the former color-coded system that was used by the province and the fact that we're far beyond the threshold for red, which was 40 people testing positive per 100,000 as our rate. And now we're up near 90. And so that is putting us into, close to gray territory. I think maybe at one point the threshold there for the lockdown was 100, but we're of course all in lockdown now. But what it signals is, yes, we are back into that kind of territory where we might have thought this part of the province wasn't so affected.
Okay, thank you. And can I ask you about the more contagious variant? I think it's probably you as well, Dr. Etches. They announced today that some more cases were found. Were any of those in Ottawa? And can you tell me what Ottawa is doing to try to track whether there are more cases?
Yes, so as far as I know, there's only been one person confirmed to test positive for COVID-19, and then that variant of the COVID virus was found to be the UK variant after someone returned from travel to the UK. What we're doing is working with the Public Health Agency of Canada to ensure that we have the ability to follow up with travelers who've returned from the UK or South Africa and follow up with their names and contact information to be able to reach out, and this is what we've done, reach out with phone calls, letters, and requesting that people are in fact tested for COVID-19, whether they have symptoms or not, because we know there can be asymptomatic infections, to go that extra step to see if we can detect the UK variant here and then contain it. So no others have come back testing positive yet, to my knowledge. We've had others who have gone for testing following that outreach. And then if they test positive, we'll check for the UK variant. So that is still a work in progress and something we'll continue. We're planning to do this as a routine practice for people who return from the UK and South Africa.
Thank you.
Thank you very much, Liz. We will now be going to Joanne Loshes at Post Media.
Hello, this is a question for Dr. Etches. I'm wondering if you can talk maybe a little bit about how, if you're getting the response that you're hoping for, what will the timeline look like in terms of returning to where we were in late November or early December?
Yes, so, well, we've seen how quickly things can go up, and they usually come down a bit more slowly. That's been our experience. However, I'm very hopeful that we can see the curve start to turn within a week, even within a week. It's possible. When we cut off those contacts to others outside of our household, there's less transmission that can occur. We can see that, hopefully, given we've had more measures in place since the holidays, since December 26th. And so I think over the coming weeks, then we're looking for that decline in the rate of COVID in our community across multiple measures that can validate that things are coming down again. I think we're not expecting to get COVID down to zero before people are back in schools. We know we were managing. We had a balance with the COVID level and enabling schools to be open. So we'll be looking for that decline, a steady decline, and I do think we should be able to see that and reevaluate at least the schools question in the coming weeks. However, the basics have to remain in place for months. Like, we really need to remember it is our individual actions of keeping distance between each other that is going to make this successful transition to when we're protected by the vaccine. So the idea that some of our actions now, it's just routine for us to limit our contacts. It's just routine for us to wear a mask. That needs to remain for months.
Thank you. So the next question is, and then hopefully within a week, we should be able to assess whether these measures are having an impact.
Well, it'll take longer to see if these measures, but right now I'm looking to see probably an impact from the measures put in place on December 26th. It usually takes about 2 or 3 weeks to see a change from some sort of public health measure intervention like a lockdown. So we had the first lockdown on December 26th, and now these additional measures, again, adding to the protections, probably that will take a few weeks.
Thank you.
Thank you very much. Nous allons maintenant passer à Samuel Blais-Gauthier à Radio-Canada.
Oui, bonjour. Donc, une première question pour Dr. Etchis. Dr. Etchis, il y a le propriétaire des sénateurs d'Ottawa qui a, sur les réseaux sociaux aujourd'hui, parlé de son plan, un plan qui prévoit 6 000 personnes au centre Canadian Tire. Et selon lui, donc pour ce qui est des sénateurs d'Ottawa, ça serait un plan avec 6 000 personnes, 6 000 fans. Ça serait un plan qui serait sécuritaire selon lui. Qu'est-ce que vous en pensez?
C'est possible avec le règlement provincial d'avoir des sports professionnels qui continuent. Si le chef en santé publique, notre chef Dr. David Williams a approuvé le plan et j'ai vu et j'ai approuvé le plan pour les sénateurs ici de participer dans cette approche, mais ce n'était pas un plan avec les fans. C'est pas possible d'avoir les événements comme ça. Les mesures que j'ai vues, c'est plus pour l'équipe, de protéger les membres de l'équipe. Et si une compagnie comme les Senators veut changer le plan d'avoir les fans là, ça c'est important se demande que le médecin-chef en santé publique pour la province va approuver le plan.
Could you repeat that in English, Dr.
Yes.
Doctor, maybe I could just offer a quick comment because Mr. Melnick, just in the last few minutes, has clarified his request to have 6,000 fans in the stadium. And he said it's not the appropriate time. I'll just read out. He said, well, the Senators organization remains optimistic that we'll have an opportunity to eventually welcome fans back to the Canadian Tire Centre. Now is not the time. So I appreciate Mr. Melnick saying that. I think most people would agree. Cramming 6,000 people into one confined space is not a good idea at this time. So, en français, M. Melnick a retiré son suggestion pour 6 000 spectateurs à la Centre Canadian Tire. Et ça, c'est la bonne réponse parce que ce n'est pas le temps d'attirer beaucoup de monde, 6 000 personnes dans une place pendant une pandémie. So I apologize, Dr. Verba. That was just the update we had.
Thank you, and I agree with that assessment. The way the professional sports organizations are operating is under provincial regulation, which allows them to go forward if the chief medical officer of health for the province, Ontario, that's Dr. David Williams, if he approves the plan. And then I also, as the local medical officer of health, reviewed the plan and I approved it, which was for protection of the team members as they were playing and the workers, and including ways to monitor how effective their protective measures are. And that plan that I saw did not involve fans.
Merci beaucoup. Ma seconde question va au maire Jim Watson. Lorsqu'on a annoncé le deuxième confinement, vous êtes monté aux barricades en qualifiant les mesures d'injustes pour les gens d'Ottawa. À la lumière des chiffres qu'on a en ce moment et des nouvelles mesures, comment en français, Monsieur le maire, vous qualifiez ces nouvelles mesures-là qui s'ajoutent? Est-ce que c'est justifié maintenant selon vous?
Mais certainement, dans le mois de décembre, la situation est plus positive pour la ville d'Ottawa. Je suis très fier de la réaction des petites entreprises et des résidents de la ville d'Ottawa. Malheureusement, pendant les dernières semaines, la situation a changé et c'est plus sérieuse maintenant. Et ça, c'est la raison que j'ai dit que j'appuie pour les suggestions, les décisions de la province de l'Ontario. Et c'est la même situation avec Dr. Etches et mon collègue M. Eglai et M. Demonté. Nous sommes ici pour dire c'est le temps pour continuer d'encourager les résidents de suivre des règlements. C'est des règlements et les lois, pas des suggestions. Et c'est une situation très sérieuse, non seulement pour la ville d'Ottawa, mais pour toutes les municipalités, particulièrement les grandes villes comme Toronto et Mississauga. Il y a des grands défis et avec des grands défis, c'est nécessaire pour des nouvelles actions pour aider la population avec COVID-19. Merci.
Merci beaucoup.
Merci beaucoup, Samuel. Nous allons maintenant passer à Kenza Beladi à TVA Gatineau, Ottawa.
Bonjour, ma question, Madame Etches, Dr. Etches, vous avez déjà un peu répondu en anglais. Je veux juste avoir une question en français. C'est en lien avec les hôpitaux. Là, on sait les projections, les prévisions qui ont été annoncées un peu plus tôt aujourd'hui sont quand même, on parle d'importantes données. On sait qu'un quart des hôpitaux n'ont plus de lits disponibles dans les soins intensifs. Un autre quart, il restait 1 ou 2 lits. La situation à Ottawa, c'est comment là, au niveau des soins intensifs des hôpitaux? Là, on est sur le point d'être surchargé, si je comprends bien.
Oui, mi-décembre, nous avons 0 ou 1 personne dans les soins intensifs dans nos hôpitaux et 10 personnes avec COVID-19 dans les hôpitaux. Aujourd'hui, c'est 33 personnes dans les hôpitaux et 11 personnes dans les points de soins intensifs. Alors, c'est une augmentation rapide et si le taux continue comme ça d'augmenter rapidement, ça c'est difficile pour les hôpitaux. Il va annuler les processus pour le cancer, pour aider avec les problèmes cardiaques et on veut éviter cette situation. C'est un grand but de ces mesures annoncées par la province aujourd'hui.
Merci beaucoup, c'était tout de mon côté.
Merci beaucoup à tous. Thank you everyone for your time. This is all the time that we have today. C'est tout le temps que nous disposons aujourd'hui. Have a great day. Bonne journée.
Merci.